Hello, everybody, and welcome back to The Advisor with Stacey Chillemi. I'm so excited today because we have a very special guest all the way from Australia, and he is an amazing gentleman. His name is Gary Woolums, and he is a PEMF practitioner, and he does PEMF therapy. And he is just an amazing individual that wants to share with you the overall powerful things that PEMF therapy can do and how it could actually improve and help heal the body overall. And so he's here today to talk about it and tell us a little more about how this therapy is so vital to lots of people who really are looking for ways to heal their body. So, Gary, thank you so much for coming to the show. Can you tell everybody a little about yourself and what you do?
Okay, thanks, Stacy, for having me. Yes, well, so I'm a PMF therapist, and PEMF, that stands for Pulsed Electromagnetic Field Therapy. Pulsed electromagnetic field therapy is has been around for 20 years. It's prescribed by doctors in Europe and in hospitals. There's lots of science behind it, research behind it. It's FDA approved in the U.S. for brain cancer, one form of brain cancer, bone fractures that won't heal, called non-union bone fractures, depression and anxiety, unresponsive to pharmaceuticals, incontinence, and one form of arthritis. And you go, well, wow, that's lots of different things. Well, in essence, PEMF is um, is a cellular charging system. So your cells are just like a battery. They have a voltage. It's measurable. They've known this since the 1920s. And in the essence, so this is a cellular charging system. So any chronic illness, any injury has an associated low voltage. There can be other cofactors. Health is about balance. You have too much of something, not enough of something, not enough nutrients, too much. There can be toxins, of course, viruses, bugs, and so on. Stress, that's a huge one. So PMF addresses one of the deficiencies, and it's a bioelectric deficiency. So we are fundamentally electric. That's our cells in our body, and that's running the show. It's running. It determines the speed and efficiency of how your cells work, your metabolism, your blood chemistry. So this addresses any bioelectric deficiency. And PMF, how it works is you lay on, it looks like a yoga mat. So there's a full body mat, and within the mat, and there's other smaller applicators. Applicators are what generate the PMF, the pulse electromagnetic field. They're just big copper wires inside. And if you run electricity through a copper wire, the physics of that generates a electromagnetic field. And electromagnetic fields uh, go through every cell in the body. So one of the things that's great about PMF, it gets every cell. It gets your bone marrow. And that's the same physics used in a generator. To induce currents in copper wires, we're inducing currents in the cells because the cells all have a charge. They work just like a little battery. So so you lay on this mat for 15 to 20 minutes, and we do the whole body because let's say you have a bad knee as an example, all right? One of
Mhm.
the cofactors in that knee is it has low voltage, and the cells aren't working right there and not repairing like they should. There's many reasons for that. So we charge the whole body because low voltage in the knee is draining the rest of the body. And people will tell you that this pain, it saps my energy. That's exactly what it's doing. You're losing electrons from the knee. It's draining the rest of the body. So we do the whole body, which is getting the knee. And then we have a smaller applicator. So it's a smaller pad. size of a pillow, or even smaller, a little palm-sized pads, and
Yeah.
we can wrap the knee, and there's coils in that, and then we're going to charge the knee extra because of the low voltage.
Right.
And uh, this is some people will notice things right away in one treatment, and other people it can take a long time. There's a cumulative effect too. So this is a healing system.
Yes.
It's not a masking system, and so it takes time.
Wow. That's very impressive. Now, you had mentioned that you had some problems in the past and that you also used the PEMF
Yeah,
therapy and
yeah.
it helped you. Can you tell us a little about that?
Yeah, well, that's how I initially got involved. So I was in an accident in the States, and I broke my back. So I sheared my sacrum. So that's the big triangular bone that hangs down in between the two hips, not the tailbone, way up. So I completely sheared that in two, totally out of alignment. And there's nothing they can do because there's too many nerves and large veins and arteries going through there. So
Yeah.
it finally shifted back into place. But I was on crutches for 7 months. So
Wow.
long story short, I had 26 years of pain and stiffness. I
Mm.
spent 50 to $60,000 getting symptomatic relief, mostly from chiropractors, but I tried everything, acupuncture, neural, NES, and you name it. I've tried it, tapping,
Yeah.
uh, and with the chiropractors, I get some symptomatic relief, but it come back in 2 to 3 days. I
Yeah.
found out about PMF. I did a lot of research, and that's what I suggest people do. There's lots of information out there. It's a little bit confusing, but I'm happy to help if you want to get in contact me, which we'll discuss later. And I had to buy a system. This was nearly 8 years ago, and uh, in less than 2 weeks, um, spending a half an hour twice a day, it was gone. And that was eight
Wow.
years ago. It's still gone because I do mine every day, and you would too if you've seen what PMF can do. Um, the other thing I didn't mention about cellular voltage, they've also measured in studies, and there's lots of clinical studies on PMF. There's over 4,000 on PubMed,
Hmm.
all showing lots of different benefits over 100 different disorders. Because any
Wow.
chronic illness, any injury has a low voltage. They've done a study and they've measured the cellular voltage, and
Yeah.
it's measurable. It's very low voltage.
Hmm.
It's 60 times less than a double A battery. But
Wow.
as I told you, Stacy, before, it's running the whole show. It's running your metabolism. We are primarily electric.
Wow. That's amazing. Now, is this something that you do on a daily basis, or is this something a person can do a few times and it might help their situation, or is this like a practice that you really should probably, devote a certain amount of time each day to do it?
Yeah.
What's the procedure?
Okay. All right. So uh, most if you have a chronic illness, so you have a low voltage. There's lots of different reasons for that. So finding the source of the problem, this is going to address it. But for people with, let's say, autoimmune, I've treated a lot of people with autoimmune, and especially rampant in young females these days. It's just amazing. So autoimmune, chronic fatigue, fibromyalgia. I think depression is partially autoimmune.
Yeah.
And with them, what's causing that one of the cofactors, that low voltage, it's hard to say. There's lifestyle, nutrition is so important, but
Yeah.
so is the mind. And if you're not And stress. Stress is huge. I can have two people come to me and with a problem, whether it's musculoskeletal or let's say autoimmune, and one is highly stressed. Stress is with many people, it's a 24 by 7 negative current that's even difficult for PMF to overcome unless you deal with with that, which is very powerful. So to answer your question, Stacy, yeah, most of the time, it's something that you should, you look at getting the system and doing every day, you and your family.
Right.
Um, just to, as we age, our voltage that's part of aging. So
Yeah.
you can't deal with that. So, injuries, this is, if you have a broken bone, this will heal bones really quick. So, that's something that a broken bone, an injury, you can get over.
Yeah.
Some people don't get over their injuries and may need to do it. So, but generally, I look people in the eyes, I say, I don't care if there's anything wrong with you. You should get one of these systems and
Yeah.
do it for the rest of your life because as we age, our voltage decreases and uh, all the major health conditions. One of the cofactors of that is, there's a low voltage associated with the pathology. There can be other things, nutritional deficiencies, stress, as I
Mhm.
said, and uh, you know, uh, innumerable things.
Yeah.
Yeah.
Wow. That's amazing. That's truly amazing. Before I spoke to you, like I knew about the physics and the voltage and everything, but I never knew about PEMF therapy. So this is all new to me and it sounds very intriguing. For someone like myself who has a chronic illness, this sounds, very promising. And, for people, I could see, doing it on a daily basis or doing it, on a frequent basis, how it could recharge the body and help the healing factor and promote the healing. And
Yeah.
it seems like an amazing therapy. And now when you have the flat mat, is the inside the flat mat you mentioned, is there the copper wires? It's just like a recharge kind of thing. Like how does the mat look, or how does that pillow look like that you use?
Well, it looks like there's a full body mat, and then we have a pad the size of the pillow. So, they're about this thick, a couple inches thick. So it looks like
Mhm.
a thick yoga mat, and
Right.
within that there are copper coils.
Okay.
About the size. There's six big copper coils about the size of a dinner plate, and
Okay.
and the physics is if you run electricity through a copper coil, it generates an electromagnetic field, and electromagnetic fields go uh, uh, go through your clothing and they get every cell in the body. But if you turn it on and off,
Hmm.
that's the same physics used in a generator or a pad charger is a little for your cell phone is a little PMF device and it's charging the battery. And we're, like I said before, our cells are just like a battery. So you lay on that for around 15 minutes and then say if you had a bad knee, then you'd focus and charge that low voltage area even more.
Right.
The thing about, and again, the metaphor of charging a battery, charging the cells works. A charge lasts around 6 hours and then it
Hmm.
goes back down. So if you do it a couple of times a day, you're keeping yourself topped up. Now, uh, I've been training quite a few practitioners here, and that's the other thing. I'd like to educate people, practitioners, that this is a very good adjunct addition to their practice, and it's very easy to use. And for everybody, practitioner or whatever, you set two factors on this machine. You set time, which I tell you what to do in minutes, and you set an intensity. Intensity is would be comparable to sound. There's sound waves. These are electromagnetic waves. So intensity is comparable if you were using sound waves to volume. And that's how fast you charge the cells. And there's only one side effect of this, and is that we increase cellular efficiency, metabolic wastes come out. Okay, so
Mhm.
you have to slowly or trickle charge people so you don't do it too fast. So just normal metabolic waste, forget about toxins, don't come out too fast till until the liver and the kidneys, the lungs, the skin, and the colon, those are the organs of elimination. There's a lag time before they come up to their peak efficiency too. So you just have to gently introduce it to the body in a low intensity, and that's straightforward. That's straightforward too.
Wow, that's amazing. Now, the detoxification and the changes that the healing process, how long does it usually take before people start noticing a change and they start feeling the difference, as
Well, that can vary. There's big variations in people, huge variations in
right.
people.
Hmm.
And also the type of disorder. So neurological
Hmm.
conditions are notoriously slow. But I've treated somebody, and let's say a type 2 diabetic, and a terrible circulation. By the way, I should just talk about overall benefits. So this increases circulation,
Hmm.
um, and therefore oxygenation, and that will increase ATP production, so you get more energy. It reduces inflammation and pain. It improves one of the collateral benefits, besides more energy, is it improves sleep. And I've seen people with uh, uh, watches that measures their deep sleep, or the Oura ring that does the same thing, that deep
Right.
sleep doubles or triples. It improves brain fog. Again, we're increasing the efficiency of cells, and that manifests in lots of different ways. Um, so I lost my train of thought. Sorry,
No,
Tracy,
that's
with
okay. That's,
yeah.
I think that's amazing that it can do so many different benefits. And I see what you mean, like, because it is true. Everybody reacts differently, and depending on where it is, where the actual, chronic illness or problem in that person's body, different parts of the body are going to, be faster. And some people, even if they're on previous medications, some medications even slow the healing process down. So it may take longer
Yep.
if you do the PEMF therapy, because there are some medications out there. I know some epilepsy medications slow down the healing process of the body. So, it might
Yeah.
take longer for some individuals, and everybody's different. Everyone has a different body, different age, everything. All those factors take into place. But the fact that you could actually have, like PEMF therapy, and you could have these copper coils actually rejuvenate and the cells in your body, and increase the blood flow and increase the healing process in your body, and that healing process to take place is just outstanding, especially when you talk about the detoxification factor. As soon as you go outside and you breathe the air, there are so many toxins to begin with. Then we eat all these different foods, processed foods with all these toxins, and they latch onto our body, because if our body doesn't know what they are, it just stores it. So, and then you have all the waste factor, and we have our colon. I think if you undo the colon, I think it's 12 feet, I think it is. And so you have toxins in the colon, you have toxins latching onto your organs, you have toxins in the air. We're full of toxins, and that really plays a role. Plus, if you have chronic illnesses for whatever reason, or you have injuries, these copper coils seem to be something that could actually start a whole new realm of healing in your body, and actually bring you back to the point where you could actually function and really reach that potential in your life where you want to be health wise.
Yeah, just getting back to, I was starting to tell the story of just a type 2 diabetic, uh, uh, do people notice things right away? So, this gentleman came in, and he was in his 80s, and his legs were, and it was the summertime, and he had shorts on, and his skin was the deep reds and purples, just
Yeah.
terrible terrible circulation. So treated him, and uh, at the end of that session, he started getting, blotches of flesh, the right colored
Yeah.
skin because of the increased circulation, and you could see that and he said his pain level, on the 1 to 10 scale, dropped, two to three points.
Yeah.
Um, and I've also, so some people will notice things right away, and others, I mean, I rent systems only in Australia, and uh, you know, so I rented a system to a mother, two daughters, one autoimmune, one irritable bowel syndrome, and irritable bowel started, and her teenage daughters were 17, 18, something like that,
Yeah.
and um, they rented a system for 2 weeks, and nothing happened at all, and so they decided to go another week, and then I got a call from her, and she goes, "It's a miracle!" And all of a sudden, both of them, both girls, within two 2 days, things just dropped off.
Wow.
And she was using the word miracle, just a transformation. So
Yeah.
some people, it's a slow, a gradual diminishing, and
Yeah.
others, all of a sudden, nothing happens, and the body hits some sort of threshold. I'm not sure, and then all of a sudden, it just, with those two, it just dropped away in a couple of days. So uh, uh, everyone's different, and the other thing is, people will come and get treated for one condition, and let's just say a musculoskeletal pain
Yeah.
issue,
Mhm.
and they'll notice that I've had said so many times, said, "Oh, I can't believe it! I slept like a baby for the first time in X number of years." So
Yeah.
a sleep improvement and overall general energy and mental fog. Uh, sort of disappearing, or a couple of collateral benefits. So sometimes those disappear before, the issue that they're wanting to address disappears.
Yeah. Wow, that is truly amazing. That is truly amazing. Now, you were so passionate about this, you know, and it probably your passion probably went back to when you were ill and you hurt your back and all this, being able to get healed through PEMF therapy is probably why you became so passionate about this.
Well, yeah, it's also, I went to university and I wanted to become a doctor. Okay.
Hmm.
So 4 years, but, I became disillusioned, and I just didn't like the idea of treating symptoms. So I went got a degree in psychology, but, that's the greatest reward is helping people,
Yes.
and that's why I'm with you here
Hmm.
today. Is the best way for me to help people is to educate people about it, and then they can get involved, and you can, I sell systems everywhere in the world, but I'm also available for consultation, because many people are going to they want to ask specific questions. So I'm happy to do that, and educate them. And oh, by the way, I also have, which side, Stacy? Oh, this side. Yeah, this book I've just written. It's been out. It's called Recharging Your Life with PMF Therapy. You can get that on my I have two websites. Is that okay to say
Yes,
now?
please.
Yeah, okay. All right. So my two websites are PEMF Inc. INC, all one word. So PEMFINC.com. That's the US website. And then in Australia, it's PEMF.com.au. And there's heaps of information, blogs, tons of information on PMF. And of course, you can contact me, and happy to answer specific questions.
Now, how can people get a hold of the PEMF therapy, the mats, and the other pillow mat that you were talking about? Where can people, if people really want to take a step forward and actually try this to see if it could help them, how would they get the equipment? How can they contact you, or what could they do?
Well, go to my website, PEMFinc.com. First you'll see the equipment, also, and the prices. So the system I use is manufactured by a Swiss company. They've been doing it nearly 30 years, and uh, it's made in Germany.
Hmm.
And there are three different applicators: a full body mat, a pad the size of a pillow, so
Hmm.
you would do your back,
Right.
uh, and then two smaller pads with elastic about the size of your palm. You can wrap knees
Okay.
and ankles, and you know uh, lay it flat and do it on different parts of the body. So and again, those I sell those globally, all around the world. And
Oh,
the other thing
wonderful.
that I definitely want to mention about is that I also train practitioners. And in the book Recharging Your Life, there's a couple of good chapters devoted to alternative health practitioners. As I said earlier, this is a very good adjunct to add to their business. Just to give you an example, I have a lady who came to me. She's a massage therapist and she's wearing out. She's been doing this 20 years,
Yeah.
and her shoulders and forearms and hands, are trouble, especially her shoulders.
Yeah.
And so she rented a system. She got the results, and she got a system. And then she called me, I don't know, a couple of months later and said, Gary, do you think this would go well? And she's in a town, in a rural town in Australia of 8,000 people.
Hmm.
And now, she's treating people for depression, anxiety, autoimmune, and also all the people have to do is just come in and lay on the mats, and
Hmm.
and she lo- and she loves it, and she has three systems now.
Yeah.
So, she a massage therapist went she still does massage, also uh, doing becoming a PMF practitioner. So that's the other thing is, I want to educate people, but I especially like to educate alternative health practitioners. This is a very good adjunct
Hmm.
that can broaden the scope of how you can help people.
I love it. I love it. Now, if we had to take this conversation and you wanted to emphasize on a couple important factors, what are some of the things that you'd like to emphasize to our listeners today?
Well, first off, it's do well uh, do your research, and but this is something that's very easy to use. You set two factors, as I said,
Hmm.
on a dial, on a touch screen, time and intensity.
Hmm.
The system automatically adjusts the frequencies. You're not setting frequencies, and people will get into that a little bit. You don't need to with this system. There's what's called a biological window of resonance. So all
Hmm.
our cells have a different frequency. Nerves are 2 hertz, bones are 2 cycles a second, bones are 5 to 7 cycles a second. The heart has the highest frequency. The heart has the highest voltage, and also the heart uh, 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 also has the largest electromagnetic field, which goes out about over I got to use over a yard, okay,
Hmm.
outside. So there's a field all around you, and this system automatically broadcasts a spectrum of frequencies. So for all of those different cells. Okay, so you don't have to set that. You just put the time and how strong you want the field, which you just have to go low and slow at first, so you don't detox too fast. Detoxing is good, by the way. It's
Yeah,
a sign the body's starting to respond, but you just want to do it slow.
right.
So, emphasize that, look into it, and then wanting to try it, well, you're just going to have to Google it to see if you can find somebody that's in your area. And That's one of the reasons I do rent systems in Australia is people, it's not like buying a car. You know what a car is, but everyone wants to go for a test drive,
Yeah,
and the best way is to get a treatment. But I have a lot of people do due diligence, and they just buy,
right.
especially after talking with me, and because I have lots of, treated thousands of people, so I have lots of different stories. It's it's not 100% perfect. It's pretty much 80-20 rule.
Right.
80% of people will see some benefits. They'll also get those other collateral benefits.
Hmm.
And then a 20%, I scratch my head because someone with the same condition got an improvement and another person doesn't. But there's Stacy, you would know about, there's just lots of lifestyle variables.
Yep.
And again, stress is just can be an overriding negative contributing factor.
Oh, yeah.
Uh, yeah, so
Over 70% of illnesses are just caused by stress. So it shows you
yeah,
how much
yeah, I
stress
believe
could
it.
play in somebody's life.
Yeah. That's a good stat. Thanks for that. That's going into the computer.
Yeah, no, it's definitely, I think if you're going to do something like PEMF therapy, you have to also take and contribute to working on trying to get your stress level down, working on what you put in your mouth, the food you eat, trying to
Yeah.
get better rest. I've noticed in my field, a lot of people, they'll want to pop a pill or do something real quick and they'll still have the same unhealthy lifestyle. And then they wonder, why am I not getting better? And they get angry at maybe the doctor who gave them the medicine or whatever the case may be. But it's not, or if they tried something natural and it didn't work and they get upset. Well, then you ask them, so, tell me about your lifestyle. Tell me about what you eat. Tell me how your daily life, goes. And they'll have the most unhealthiest lifestyles and they'll be
Yeah.
doing everything you're not supposed to if you want to be a healthy person. And then they wonder why maybe a natural or holistic approach to healing doesn't work, or they wonder why the medication the doctor gave them didn't work. It's because of the way you're living. And you can't expect a magical miracle, like you said, to occur if you're not going to take responsibility and how you're caring for your body overall, too.
Yeah, what you said just brought something to mind. So around uh, over 80% of my clients are females.
Hmm.
Okay. And but the males that do come to me are very interesting. A lot of them, they're biohackers.
Hmm.
Although I meet lots of female biohackers too. So it's just females are far more open to doing something about their health. And
Right.
but I do like to get the healthy skeptics because if I can get them on and do it long enough,
Yeah.
they just stop, and they just go, and they go, why doesn't everybody know about this? You
Yeah,
know? Yeah,
exactly.
yeah.
Exactly. Wow, this has been amazing. I really thank you so much for coming on this show, and you have struck my interest in it. I'm definitely going to look into this because it definitely is something that it's scientifically evidence-based. It's worked for many
Yeah.
people. There is a lot of research out there. There's a lot of positive stories, and I'm sure you have many more that you could share with the audience as well. So this is something I will try. And I really suggest that people who are, struggling with a health issue or a chronic illness, maybe look into this and, tell everybody your website one more time. So if they're interested, they can go to it.
Okay, so it's PEMFINC.com. for the US, and then PEMF.com.au in Australia or anywhere. I deal with people all around the world. So I'm happy to talk with you, Stacy. Offline if you have questions and so on. And again, uh, I can look anybody in the eyes and say, this this is the best investment you can make in you and your family. Um, and by the way, I didn't tell you that all professional sports teams use PMF. It's just, it's not talked about. Roger Federer has was been doing PMF for years, very quietly, as you would. You wouldn't want to tell your competitors. Djokovic, um, who just bowed out of the Australian Open. He uses PMF, so the U.S. swimming team has been using it for years and years. So and it's legal. So it's a cellular charging system, increases circulation, oxygenation, so athletes recover quicker, and it's good for performance. And also, um, they do more PMF right now on horses everywhere in the world.
Yeah.
The horse racing community is a very small network community, and all hor it's they use PMF because the horses run
Yeah.
faster. Yeah,
Wow.
yeah,
That's amazing. That's amazing.
yeah.
I love it. Well, this has been amazing, Gary. Thank you so much for coming on the show. I hope you'll be back and we can talk more about this and really educate people and help them understand, PEMF therapy and how it could actually benefit their overall life and go more into depth than we did today. But today was just an outstanding podcast. And I thank you so much for taking the time to actually share all this information, and your passion and your desire to help people is truly outstanding. And I thank you so much for, dedicating all these years to helping others. Thank you.
Thank you for allowing me to just talk about it and educate people, and I hope a lot of them just get into it and do some research.
Definitely.
It's something that's going to benefit so many people.
100%. I agree with you. Thank you so much. And you have a great day.
Okay, you too, Stacy.